Are dentists better compensated than doctors? Both doctors and dentists are perceived as high earners in the society. But how much do dentists make? The other day I was at a restaurant having lunch with a dentist friend. We had a candid conversation about dentistry, medicine, career prospect, and compensation. Money is a subject that many people are uncomfortable to talk about, but understanding compensation is so important to plan your future. I realized the difference in earning between dentist and doctor was significant. Hey friends, welcome back to the channel. If you're new here, my name is Dr. Erwin Kwun. In this video, we will analyze the earning of dentists and doctors in England. Both dentists and doctors spend similar amount of time studying at university, but who earn more once qualified? After graduation, dentists are able to apply for full registration with the General Dental Council. They can choose to do private work or complete dental foundation training and work in the NHS. The salary of a dental foundation trainee is £34,728. This is a 9-to-5 job, and a dental foundation trainee is contracted to work 35 hours per week. A newly qualified doctor fresh from medical school cannot register fully with the GMC. After graduation, medical doctors are provisionally registered with the General Medical Council. It's only after successful completion of Foundation Year 1 training that a doctor is able to apply for full registration. The salary of a Foundation Year 1 doctor is £29,384. This is for 40 hours of work per week. If we compare the hourly rate of a dental foundation trainee and that of a Foundation Year 1 doctor, then we'll find that a dental foundation trainee earns £19 an hour, whereas a Foundation Year 1 trainee earns £14 an hour. Newly qualified dentists earn more as they are ready to go, whereas newly qualified doctors are only provisionally registered. During training, junior doctors are often working weekends and nights. However, dental foundation trainees do not work weekends or nights. Most Foundation Year 1 doctors work more than 40 hours per week. The additional hours they actually work attract extra payment. For example, a doctor working 48 hours per week on average will have an additional of 8 hours worth at the basic pay rate. Doctors in training often work weekend and nights, which attract extra pay. There's an enhanced rate of 37% of basic pay for working between 9 p.m. to 7 a.m. This is an enhanced rate for any hours that are deemed unsocial. Doctors in training will also get an allowance for working weekends. For example, if a Foundation Year 1 doctor works one weekend in 2, he or she will receive a 15% allowance. Let me give you a working example of a newly qualified Foundation Year 1 doctor working an average of 45 hours per week, 8 of which is deemed to be unsocial hours and attract a 37% enhancement. The Foundation Year 1 doctor is rostered to work 1 in 3 weekends. Let's assume that the Foundation Year 1 doctor is not getting London allowance or any additional bonuses. The basic pay of the Foundation Year 1 doctor is £29,384. Additional pay for the 5 hours of work per week at a basic rate will come to £3,673. Enhanced rate hours for 8 hours that are deemed to be unsocial will attract 37% rate. That will give us £2,174. With weekend allowance added, the Foundation Year 1 doctor will attract a payment of £2,938, which is 10% of the basic rate. The gross earning of the Foundation Year 1 doctor working 45 hours per week will come to £38,169. This figure is pre-tax income. After deduction of tax and national insurance, the take-home of the Foundation Year 1 doctor will be approximately £29,657. The monthly take-home in this example is approximately £2,471. The take-home of a dental foundation trainee after tax and national insurance will be approximately £23,793. This gives a monthly take-home of approximately £1,982. In this example, we have not accounted for NHS pension contribution. After completion of dental foundation training, dentists then choose to work in a dental practice or enter dental core training. The starting salary of dental core training is £40,257 and goes up to £51,017. Dental core trainees may need to work weekends, nights as well. This will also attract extra payment. After a few years post-qualification, an associate dentist can comfortably earn between £60,000 to £90,000. After a few years post-qualification, a junior doctor may be at the level of ST3, earning a basic salary of £51,017. The earning of junior doctors is significantly lower than dentists, and it takes time for doctors' salary to catch up. Most dentists are self-employed contractors in general practice. Their work consists of a combination of NHS and private work. Profits of dental practices vary greatly, but in general, a dentist can earn around £50,000 to £110,000 a year. Exclusively private dentists can earn more than £110,000. NHS dentists are paid per unit of dental activity in England and Wales. Unit of dental activity, also known as UDA, is a measure of treatment. When a patient goes to a dental practice under the NHS, there are 3 NHS charge bands. Band 1, which is equivalent to 1 UDA. This covers an examination, diagnosis and advice. If necessary, it also includes x-rays, a scale and polish, and planning for further treatment. Band 2 is equivalent to 3 UDAs. This covers all treatment included in Band 1 plus additional treatments such as fillings, root canal treatment, and removing teeth. Regardless whether a dentist is doing 10 fillings or 1 filling, this is still 3 UDAs. Band 3 is the highest. It is equivalent to 12 UDAs, covering all treatment included in Bands 1 and 2, plus more complex procedures such as crowns, dentures and bridges. There's also emergency treatment band, which is equivalent to 1.2 UDA. The practice is paid by the NHS based on the UDA rate. So some practices may be paid £20 per UDA and other practices may be paid £25 per UDA. The dentist will only get a percentage of the UDA received from the practice. Usually practice will charge a license fee between 40 to 50%. Let me give you a working example. A practice may earn £20 per UDA and the license fee is 50%. The associate dentist will then earn £10 per UDA. Most associate dentists work as self-employed and they agree on the number of UDAs they are willing to provide. This is usually between 5,000 to 7,000 UDAs. If a dentist fails to meet the agreed target, then the dentist may be liable to a fine or clawback. This is when the practice will charge the dentist because the dentist has not provided the treatment agreed. Let's run through the numbers. An associate dentist has agreed to provide 7,000 UDAs per year and is earning £10 per UDA. So this will give a total of £70,000 per year. £70,000 may sound like a lot of money, but this is not the net income of the dentist. We need to factor in lab fee, bad debt if patient has not paid, and the biggest one is income tax. So the take home of the associate dentist will be approximately £45,000. If the dentist is contributing to NHS pension, then the take home will be lower. Dentists have higher earnings from an early stage of their career and the chance to spend that money due to more sociable hours. Doctors are usually spending a lot of time working in hospital during nights and weekends. It's only after a doctor becomes consultant that the earning will hit £84,000. It usually takes 10 years of training before a doctor can get a consultancy post. The salary ranges from £84,559 to £114,003 per year. Consultants have scope to increase earning by attracting Clinical Excellence Award and starting private practice. If you're interested to get a breakdown of consultant earning, click the video to watch it. If you haven't subscribed to this channel, make sure you subscribe for more videos like this. I'll see you in the next video. Take care everybody. Bye bye.